It took barely a fortnight after the Queensland border reopened for COVID to reach the furthest tip of the state.
It has arrived, and it's amongst all of our major communities at this stage.
Health teams in the Torres Strait have been preparing for this moment since March, when they launched one of the country's most logistically complex vaccine rollouts. Their efforts have paid off, with more than 3/4 of residents over 12 now double dosed.
Many people are coming forward for their booster shots, which is great to see. Mixed amongst that, though, are also the people coming forward for their first doses, who've been waiting to see local cases before they decided to pull the trigger and get the shot.
Among those on the front line is health worker George Morso, who recently administered the region's 10,000th vaccine.
English is our third language. I sort of made it my goal to be the engager between the community and the vaccination team.
But after the virus reached his tiny community on Bardu Island, a 20-minute plane ride from the Torres Strait's main hub, he's concerned about how the local health clinic will cope.
There's only 2 nurses, 3 health workers, and an admin officer and an operational officer. If one of us get COVID, then we're stuffed, really.
Community leaders have called for measures to restrict travel to the region.
Having a blanket approach across Queensland has certainly made us concerned that they're not really understanding the different scenarios that Indigenous communities are in.
There are now more than 200 active cases in the Torres Strait and Cape York. And while some communities have managed to fully vaccinate almost all residents, in others the majority of the population is completely unprotected. Further south, there are around 100 cases on Palm Island, where only about half the population is double dosed.
A bit of a shock, a bit of urgency around the community, and people were, lining up to get their vaccines. People were getting swabs done just to do their part, which is, a very encouraging sign.
Aged care residents have been evacuated to the mainland, and a temporary morgue was delivered to the island after a grim warning from health authorities that the community could lose between 5 to 65 people to the virus.
That's a sign of, do you have the facilities set up to accommodate a influx or a contamination within the community?
Rapid antigen tests are now available on the island, but the local council says they've been playing catch-up after waiting 3 days for PCR test results in the crucial early stages of the outbreak. As case numbers across the country become harder to track, medical expert Jason Agostino says it's difficult to provide a targeted health response.
Yeah, to be honest, we no longer have a good idea about what is happening to the Aboriginal and Torres Strait Islander community through Omicron. The reporting systems in most states are overwhelmed, and because of that, people aren't recording Indigenous status.
Without that information, Dr Agostino says crucial treatment may not reach those who need it most.
We recommend in lots of settings that Aboriginal and Torres Strait Islander people receive certain treatments earlier and at younger ages. And without the system identifying that person as Indigenous, they're not going to be able to, there's a risk that they won't be able to access that therapy.
The remote Northern Territory community of Yuendumu recorded its first COVID cases just over a week ago, sparking fear in a town that was only 40% fully vaccinated.
As a community member, I had expected a lockdown, like a snap lockdown.
Northern Territory Health, already battling staff shortages, deployed a rapid response team, but it was a far cry from responses to previous remote outbreaks, where large teams were sent to test all residents and hundreds of positive cases were evacuated to quarantine facilities.
We're constantly being told that we would love to do this, but we don't have the resources, but we don't have the resources, but we don't have the resources. And so essentially it's kind of just being told, you're just going to have to deal with what happens, which is, it's frightening, and you feel alone and you don't feel supported by the government right now.
The approach here is entirely appropriate, and indeed this will be our approach in the future when it comes to communities.
Deputy Chief Minister Nicole Manison has lamented the disappointing turnout for vaccines in Yuendumu.
One thing I want to say, which was very disappointing, was that we only saw 11 vaccinations in the last 24 hours in Yuendumu.
It's so easy to blame the community, and that's obviously the angle that I have seen in these press conferences, when, in my opinion, you're failing the community and you don't want to take that responsibility on yourself.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.